Welcome to the Northern Brain Injury Association's presentation to assist families affected by a brain trauma. Family after brain injury. Brain injury is an event that causes brain dysfunction, and it does not just affect the injured person, it affects families, friends, and the entire community. The primary causes of brain injury are trauma, lack of oxygen, infection, stroke, tumor, and surgery. And brain injury creates a change, a lot of change that can seriously change families. Roles may get reversed, income may be dramatically affected, and relationships may be forever altered. In some instances, children may take on a parenting role for an injured mother or father, or act in a confidant role for a parent caring for an injured spouse or child. When a loved one is diagnosed with a significant physical health issue, it is normal for families to seek support from other family and friends who often rally around to express concern and offer assistance. But when a family member has a brain injury, the response can be very different. Friends and extended family tend to fade away, and increased isolation begins to take a terrible toll on emotions. Feelings of confusion, anxiety, stress, guilt, shame, self-blame, depression, fear, and anger are common. These feelings generally vary over time and according to the stage of their family member's condition, but the social, emotional, and psychological impacts of brain injury are often quite profound. In addition, stigma, fear, discrimination, and a lack of understanding may mean that families sometimes minimize, conceal, or deny the injury. This fearful non-disclosure may distance persons from family, friends, and the wider community, with the result that they may face the changes, issues, and concerns in isolation. Yet, although families take on significant caregiving roles, they are usually ill-prepared for the associated challenges and all the services and supports required to cope with brain injury. Families want and need to be an integral part of treatment and community rehabilitation teams, as they are deeply concerned about the recovery of their loved one. But despite their intimate knowledge of the person and the changes they have after an injury, families report that their perspectives, observations, and opinions are rarely sought. In fact, their information is frequently discounted by professionals and service providers, and their efforts to be actively involved are often met with disinterest or suspicion. Even worse, some professionals behave as if the family were actually responsible for the injury and/or for a slow recovery. This makes a bad situation worse and is one of the issues frequently brought up at group meetings. The first major adjustment faced by families after a brain injury is having someone that they have known for years suddenly behave in ways that are random, unnatural, and sometimes even improper. Some examples are rigid thinking, the inability to see alternatives, repeating things over and over again, forgetting things as fast as they learn them. Caregivers have to repeat things over and over. Self-focus, me, explosive anger, debilitating depression, and massive mood swings, often with no warning. Loss of abilities, things that they could formerly do. Changes to sexual interest. Changes to appetite. Sleep problems. The inability to stay on task. Changes in identity. Reduced self-awareness. And beyond behavioral and cognitive changes to a loved one, families may also face substantial financial burdens, experience career interruptions, and social networks may be disrupted or vanish. In addition, due to changes from brain injury, spouses may face a sudden loss of intimacy, their best friend, and personal support. To complicate matters even more, services and supports to cope with the overwhelming stress that families experience after a brain injury are rarely available. This results in families often feeling powerless to do anything other than worry, despite the critical role that they play in the care and rehabilitation of their loved ones. Sadly, families who provide so much care rarely get any recognition or compensation for their contributions. And family members must suddenly serve in a variety of caring capacities and roles, many of which they have no prior experience in providing. Some of those new roles may include identifying and securing housing, providing crisis intervention, assisting with navigating social service and medical systems, advocating on behalf of their loved one, monitoring symptoms and support to treatment plans, maintaining records of previous treatments, medications, and hospitalizations, providing information on the context of a loved one's life to assist professionals in understanding them as a whole person. In addition to coping with the brain injury, the complexity of accessing the referrals and resources needed makes life very challenging for those providing care. Families who face dual diagnosis of issues, such as brain injury and mental health issues, experience even greater frustrations as they are forced to navigate what are essentially two separate systems, which treat the conditions as completely separate issues. This makes it even more challenging for clinicians to understand and respond effectively, and creates even more confusion for families and loved ones. The good news is that numerous studies have shown that family involvement in care and recovery result in significant benefits for both the individual and the healthcare system. Some of those benefits include decreased rates of hospitalization, enhanced treatment choices, increased rates of recovery, decreased involvement with the criminal justice system, savings to the health and social service systems. Research clearly shows that families who receive education about brain injury and help to develop coping and problem-solving skills achieve improved outcomes. It is therefore important that families connect with people who understand because they have been there. So what can families do? Where can they turn for help? A great place to start is by creating and maintaining family support groups. These informal groups support and educate those who find themselves facing the many challenges associated with brain injury. These groups allow families to speak freely, exchange coping strategies, and educate themselves about their loved ones' problems, as well as their own needs for support. Particularly important components include basic coping skills, hope-instilling strategies, building on strengths, providing choices, and avoiding learned helplessness. After becoming members of self-help groups, most participants state that they feel they are better able to navigate the medical, financial, and social systems and have reduced their tendency to blame themselves. They also have a better capacity to deal with the external stigma and discrimination sure to happen. Family groups not only strengthen participants, they help communities to organize and effectively lobby for their specific needs, advocate for additional resources, and establish networks of support. In closing, family support groups make a significant positive impact on lives, those of the injured and of those who are now charged with their care. They vanquish blame and shame, instill hope, and provide ways to cope with the many changes to individuals and dynamics in the family. For while families may not personally experience the brain injury, they still experience very real pain, frustration, and depression when they do not receive the help that they desperately need. For more information about brain injury and services that may be offered in your area, please contact your local, state, or provincial brain injury association.